The Patient Kidney Foundation says the idea for the free clinic was to show appreciation to the general public who have been assisting through financial contributions over the years. President Marva Gilks says they are pleased to be giving back to the community.
They've been donating for us in one way or the other, either monetary or clothes or so forth. Yeah, so we decided to give back today. But today we're trying to more focus on educating, giving the persons an opportunity to know their vitals so they could follow up it and keep monitoring. Because throughout this year we want to emphasize on education and prevention and care.
Involved also were the Food and Nutrition Council, Cancer Society, Pink Ribbon, Sickle Cell and Diabetic Associations. Lydia Brown, Executive Secretary of the GFNC, says the focus should not only be placed on treatment, but preventative measures also.
We have some samples for persons to try. In the bottle here we have golden apple juice, which is very low in potassium. We have here a dish made from eggplant. There's absolutely no salt in here, but it's very well seasoned and very tasty. Persons that have been here today, and you see it's almost gone, persons that have been here and have had a taste have really enjoyed it. With that we have bread, which we're using as a chip to use with this dip. We're showing a different way of leaching our provision foods. So we advise people to eat local, but for the provision foods, they're very extremely high in potassium. So we're showing persons that we would say to soak the food. You put the amount of food in like 10 times the amount of water, and you keep throwing off the water every 2 or 3 hours and replacing it with room temperature water. But there's another method that can be used where you can actually bring the vegetables to a boil. And once it's boiled, you throw off that water and then you can proceed to cook that vegetable in another water again.
Dr. Ryan Lendor, General Practitioner, who also volunteered for Thursday's health fair, says his main concern is the increase in chronic diseases.
Chronic illness, I think, kills us because we are not handling it in a timely fashion. And I think now that people understand what they have to do and lifestyle changes that need to occur, I think we'll begin to see a major difference in the handling as well as management of chronic illness in Grenada.
Member of the association, Ann Hopkins, says following the health fair, the information will be shared with the Ministry of Health.
The data collection here will be given to the Ministry of Health. How much breast exams we did, if we find any lumps, how much mammogram we sent for, how much referral we did. Because it's very important. You cannot have a health fair without having proper accountability. If we do somebody's breast and we find a lump, we follow them up. I follow them up together with Dr. Nixon, because we don't want them to come here, find something, and then we just leave it vague. No.
Thursday's health fair will be followed by an educational public forum on March 14th at the St. Paul's Community Center, and later followed by St. Patrick's. At present, the foundation is assisting 19 patients with dialysis, with 3 on the waiting list. They anticipate the figure for those needing assistance will increase to 30 by end of year. Eugenia Peters, GBN News.